What's up everyone? So today we're going to be going over some medical assistant patient scenarios. So I picked out the best 7 scenarios which I thought you would or will encounter in the medical field. These are also some that you would find on your certification exam for medical assisting. So they are very good to know. Scenario 1. A patient comes in for blood draws and says she had a negative experience with a previous intern who performed her blood draw. She requests an actual MA with qualified experience to perform her blood draw this time. Now let's identify the correct response out of these 3 answer choices. We have A, well, everyone has to learn somehow, you'll be fine this time, it's probably not going to happen again. B, I'm really sorry to hear about your previous experience, I can assure you I performed this procedure many times and am confident in my skills. If you still feel uneasy, I can go get you a more experienced staff member to assist you today. And C, I'm sorry you had a negative experience. I'll check if someone else can perform it this time. Okay, so I definitely think we can rule out A. The response is very dismissive, it invalidates the patient's past experience, and it prioritizes the intern's learning experience over the patient's comfort and care, so that's definitely not what we want to do. Now, if we look at C, it definitely acknowledges the patient's experience and shows willingness to help, but it lacks clarity and reassurance. We always want to reassure the patient that we know what we're doing, we're confident in our skills. So it lacks the responsibility and it can leave the patient uncertain about what will happen next and doesn't fully rebuild trust. So for this scenario, answer choice B will be the correct response because it validates the patient concerns while expresses empathy, and it takes ownership, but it also reassures the patient that their request will be respected while, advocating for yourself, still reassuring the fact that you know what you're doing, you performed this procedure many times, but of course we never want to force, you can never force a patient to consent to anything, but we always want to reassure. Moving on to scenario 2. We have, I've been waiting almost an hour. Why even make an appointment if you can't stay on schedule? So right off the bat, we can clearly tell the patient is very annoyed, agitated, and concerned. And in healthcare, you always want to be empathetic. People are at the hospital, usually they're not having the best day, so we always want to be considerate of that and show empathy. So let's keep that in mind as we go through these answer choices. First, we have A, which says, I'm really sorry about the wait. We're experiencing some delays, but your time is important to us. I'll check with the provider and keep you updated. Thank you for your patience. B, that's not my fault. We're understaffed and everyone's waiting. C, I understand you're frustrated. We're running behind, but I'll let the provider know you're waiting. So right off the bat, we probably can outrule B as very hostile, angry. Again, it's healthcare, people are probably not having the best day, so it's always best to not be defensive and unempathetic, so we can rule B out. Now we're left with A and C, but we're going to go with A as the correct answer. A shows empathy, takes responsibility, and communicates the next steps, while C acknowledges the wait and offers to act, but it doesn't apologize or reassure the patient. So A would be the correct response in this scenario. Moving on to scenario 3. I don't want my child to get any vaccines. I've done my research. So this is a very controversial topic, vaccination. So let's go through the answer choices. We have A, okay, I'll let the provider know you're declining vaccines today. B, that's irresponsible. You're putting your child and others at risk. And C, I understand you have concerns. Would it be okay if I shared some up-to-date information and answered any of your questions before you decide? Our goal is to support your child's health and your decisions. So right off the bat, we can rule out B. It's very judgmental. You're putting your opinions into healthcare, and that's not what we want to do. And it also just deters the patient from wanting to come back to our clinic. And that's not at all what we're trying to do. We want our patients to keep coming back, keep making appointments with us. That's what we want. So this definitely destroys trust with our patients. So that is not the correct answer. Now, A documents the patient's decision, which is good. Documentation is very important in healthcare. If you did not document it, it did not happen. So we always want to make sure we document these types of encounters with our patients so it can be added to their records. The strength with number A is that it documents. But the weakness is it doesn't give a chance to educate or address any concerns. So C is going to be our correct answer for this scenario. It's very respectful. It leaves your own personal opinion out of it, but it encourages making informed decision making. It opens the dialogue to have the patient ask any questions they have, any concerns, so they can make an informed decision. But we always want to keep our decisions, our own opinions, out of the conversation, because at the end of the day, it's the patient's choice what they decide to do with their health, so they can make the best informed decisions. Moving on to the next scenario, we have a patient comes in speaking limited English, gesturing towards their chest, and looks to be in high distress. Now with this scenario, you will see this a couple of times depending on where you work, but you will have certain instances like this. So this is a very good one to learn and know. Let's look at the answer choices. We have A, I don't understand you, can you write it down or come back with someone else? We have B, you're having chest pain, I'll try to get some help, please stay seated. We have C, one moment, I'm gonna get a certified medical interpreter to help us right away. We wanna make sure we understand you fully and get you the appropriate care. Now, while this encounter might be frustrating for some, it is important, again, to have empathy. This person is coming in, clearly looks to be in higher distress. We know there's something wrong. We don't want to be dismissive or show lack of empathy, so we can rule out A. B, you're having chest pain, I'll try to get help, just stay seated. We don't always want to assume, we want to make sure we're getting the appropriate care to the patient. And if it is potentially an emergency or if it's just an acute problem, we want to make sure we know exactly what is wrong with the patient. So we want to make sure we get clear information from the patient. So we're going to get a certified medical interpreter so we can see exactly what is the issue. So C would be the correct answer choice. Moving on to the next scenario, we have a patient is extremely angry because they feel they were skipped in line or not treated fairly. They begin raising their voice, pacing, and using threatening language towards staff. This is more common in an emergency room setting, hospital setting, but you might see this in other clinics depending on the busyness of your area, but it's still good to know. A, I can see you're very upset and I want to help for your safety and ours. I need you to lower your voice. I'm going to notify my supervisor so you can get this resolved quickly. Please have a seat while I do that. B, if you don't calm down, you can leave. We don't need this. C, sir, I understand you're upset. Please take a seat and I'll try to get someone to help you. A and B are fairly close. We can clearly rule out B, although they are using threatening language. That is something we can ask them to leave for. But again, we want to keep our patients. We don't want to deter them. We want our patients to keep coming back. So we would have to rule out B. C is very understanding. It acknowledges the patient's emotions, but it's very passive and boundaries are unclear and there's no safety planning. So for this scenario, A would be the correct answer choice because it has a calm tone, it sets the boundaries, and you're taking control, and it signals to the patient the next steps, and it is protective of everyone's safety and our own. So A would be the correct answer choice. Moving on to scenario 6. A child is screaming and resisting while you attempt to take vitals. The parent is apologetic but unsure how to help. The child won't stay still or let you near them. So if you work in a pediatric clinic, you will see this a lot of the time. Kids are sometimes difficult, especially when they're unsure about certain procedures. So you always want to make sure you're talking them through what you're doing and making them at ease. So let's go through these answer choices. We have A, I know this is scary, we'll try again in a minute. Gives them space, gives them time. We have B, it's okay to be nervous. We can try this together while you sit on mom's lap. You can even help me count while I check your heartbeat. We'll go slow and you can tell me when you're ready. We have C, if you don't sit still, we're not doing this, you're being too difficult. We can clearly rule out C, it invalidates the child's fear and it probably would increase the child's distress. So we want to stay away from C, it's a child. They're going to be scared of these procedures. Going to the doctor is scary. I don't think a child likes going to the doctors, so we want to rule out C. It's important to help calm the child, then usually the best way to do that is to talk them through it, maybe ask them to help. So B would be the correct answer for this scenario. It's asking the child to maybe help in with you taking the vitals. It's asking the parent to be included as well. That can also be very calming. So answer choice B would be correct. And the last scenario for this video, a patient spills a water bottle or a child vomits in the waiting room. The floor is now slippery, chairs are slightly out of place. You, as a medical assistant, are walking past and notice the hazard while other patients in the area, including an elderly person using a walker. So as we can see, this is a hazardous environment, so this is definitely something that you would probably encounter in any clinic, hospital, emergency room that you are working at, so this is good to know. We have A, someone spilt something, I'll go tell the front desk. We have B, thank you for letting me know, let's keep everyone safe. Please watch your step, I'll block this area off and place a wet floor sign while I contact housekeeping to clean it up immediately. Can I help you move to a safer spot while we take care of it? And C, that's housekeeping's job, I'm not touching that. Now, this scenario may be difficult for some. All these answer choices are not incorrect. You would not be in trouble for saying any of these answer choices, but of course there is a better way to handle things to take control and address the problem and get help and fix the hazardous environment. So we can rule out C. A would also not be incorrect, but again, as the medical assistant and or person in the area, we want to take charge and address the situation. So let's take a look at B. It acknowledges and responds immediately to the hazard, and it takes temporary safety measures, communicates clearly with the patients, and follows protocol while keeping everyone safe. And while A recognizes the hazard and seeks help, there's no immediate action to reduce the risk. It doesn't warn other patients about the hazardous area or block off the area or use signage up anywhere. So we want to take control. We want to address the hazardous situation because it could potentially be hazardous for other patients who are coming through. So B would be the correct answer choice for this scenario. And that is all we have for today. So if you have any questions about any of the scenarios we went over today, feel free to comment down below. I can further explain any questions you might have or any doubts you might have about any of the answer choices that we went over today. If you want to see more of these videos or any other help for your certification exam or any other aspect in the medical field, feel free to comment down below and I will for sure get onto that. And other than that, thank you for watching, guys, and I hope to see you soon. Bye!